For today's topic, I'd like to talk about counselors and privacy. It's not uncommon for family members to make an assumption that, look, my person is going into therapy, they're forming a relationship with a professional, really something that I should stay out of, no real reason for me to get involved. Now, sometimes that is appropriate. Probably most times it is not. I will hear over and over again many stories of uh, persons affected by addiction who have been in and out of counselors, rehabs, detox units over and over and over again. It's not uncommon, unfortunately. When I'll ask the family members, how many times did the counselor involved with your son, wife, husband, etc., how many times did you hear from them directly? How many times did you speak with them? How many times did you talk with them? Oftentimes the answer is zero. Now, the communication between the professional and the family member is essential. I have been working with persons affected by addiction for over 30 years. In that time, as a therapist, it is invaluable to me so that I can hear what's going on at home, so that I can hear some of the details and some of the particulars that, unfortunately, many times our persons affected by addiction are either not willing to surrender or are purposefully not wanting to disclose some of those issues. So, for example, we may have someone come into therapy, not uncommon, very closed, with the attitude of, when can I get out of here? How much longer do I have to stay here? How can I do the least amount of work possible and just get whoever off my back, whether it's the judge, it's my wife, it's my husband, it's my mother, my father. I just want these people off my back. So this is very common. And when a therapist is able to hear directly from the people at home, we can then establish a more appropriate treatment plan. We have tools that we can use that we can employ based on what we hear from the family. Likewise, it's super important as well for the family to hear from the therapist. It's not uncommon for family members to assume that either things are going very well, that there are no problems, or even to assume that there is sobriety and the person is doing well in their disorder. So the idea of sharing urine samples, sharing the professional insights that a person may have from working with your loved one, these are things that are mandatory, essential, and will lead to success with your loved one.